Okay, everyone, it's 12 o'clock. Good afternoon, rather, and thank you for joining us. And I'd like to introduce myself. I'm Shannon Switkowski. I'm the Senior Director of the CTSC. And we also have Zena Hempstead joining us this morning as our finance manager and also helping in the DEIA space as well. Unfortunately, Jaleese Thomas, the usual MC for this event, is out ill today. So Zena and I are going to tag team a little bit and talk with Cynthia this afternoon with you. So on behalf of the Clinical and Translational Science Collaborative of Cleveland, we welcome and thank you for joining us for our Women's History Month celebration. This month, we'll sit down with 4 leading ladies at each of our hospital affiliate institutions and learn about their journey to leadership, how they elevate research as a priority at their institution, and ways that they personally and professionally infuse principles and values of diversity, equity, inclusion, and accessibility. Before we begin, let's learn a little bit about the CTSC. The CTSC of Cleveland is a collaborative among Case Western Reserve University and its affiliated hospital systems, the Cleveland Clinic, Metro Health, University Hospitals, and the Lewis Stokes VA Medical Center. We aspire to be a catalyst for high quality clinical and translational research, both locally and nationally, by changing the culture and environment of biomedical research, sharing resources and expertise, and streamlining the research process to move translational research from bench to bedside and to the community. Today, we celebrate and meet with Dr. Cynthia Kubu, neuropsychologist, Associate Director of the Neuroethics Program and the Center for Neurological Restoration at the Cleveland Clinic, and Vice Dean for Faculty at Case Western Reserve University in the School of Medicine. So I'm going to give you a bio of Dr. Kubu before we begin. Dr. Kubu is a professor in neurology at the Cleveland Clinic Lerner College of Medicine of Case Western Reserve University. She serves as the Vice Dean for Faculty in the School of Medicine. She has expertise in brain behavior relationships and cognitive assessment, and has a long history of working with diverse groups to help further clinical care, address clinically relevant interdisciplinary research questions, and facilitate faculty development. Dr. Kubu was elected as a fellow in the American Psychological Association in recognition of her contributions to the field. Dr. Kubu has worked primarily throughout her career in functional neurosurgery teams, and was a member of several innovative deep brain stimulation clinical trials. She has helped establish international guidelines in deep brain stimulation. Her research has been funded by the NIH BRAIN initiative with an interdisciplinary focus on clinical ethics, neuroscience, psychology, and neuromodulation. Dr. Kubu has provided considerable national service to the American Psychological Association at the Cleveland Clinic Lerner College of Medicine and the Case Western School of Medicine. In her current role, she's committed to supporting all faculty so they can thrive, with particular attention to the importance of individual differences. I believe we are ready for the Q&A. So that will be Zena.
Hi again, Dr. Kubu, and welcome. Let's start our first question with, what did you want to be when you grew up?
Well, I really wanted to be, I think, a learner, and that meant I wanted to be a professor. And I knew that I probably wanted to be in healthcare just because I grew up in a family in which my father was a physician, my mother a nurse. But I also knew I didn't want to be so narrowed in terms of what I did.
Okay, so what other career would you choose if it wasn't in healthcare?
Oh, I would be an English professor. I think I can think of nothing more fun than reading literature and studying the humanities and helping other people understand how that interfaces with healthcare and medicine and so on. So probably medical humanities.
Oh, that's great. Okay, who or what have been the strongest influences on your version of you that we get to experience today?
Well, I don't want to blame any one person for what you're experiencing today. In terms of, I think, the positive influences, I've been fortunate to have many, many friends and so on. I think some of the most important would be my mother. She's a very kind person who insists on seeing the kindness in everybody and strong respect for absolutely everybody. I think books have been highly influential, as you're seeing a theme here, because I think that literature allows you to see the world from other people's perspectives. And that's very profound and can be humbling and eye-opening.
Mm.
I've always read, when I was young, books about courageous, innovative, out-of-the-box girls and young women, and how they were often the first in whatever they did. And I admired that in terms of pushing against these cultural norms and expectations in a way that helped them be the most they could be. And then finally, I was fortunate. I went to my undergraduate institution was Carleton College, which is a wonderful liberal arts school. And I didn't realize at the time, but I was fortunate enough to take 2 classes from a world-renowned Catholic theologian, Ann Patrick. And I took liberation theology and feminist theology with her, and it helped ground my commitment to social diversity and values and action and acting on those values or praxis into a faith tradition. And that really is what motivates me in terms of what are those higher order moral factors that help you do things that may seem brave at the time or when you're afraid to act on those values.
Oh gosh, fantastic. Yeah. So let's switch to career.
Yeah.
What was your first role that set you on the trajectory to where you are now, and how did you get there?
It's hard to say this. I saw the question because Delisa is so organized, as we said. She kind of gave this to me. It's like, well, I don't know if I've ever had. I think, and I don't quite know why, but since I've been young, people have envisioned me and encouraged me to seek out leadership roles. Right. And I think that that's just a quality that's kind of inherent because I do try and live my values. And it's funny because I see that mirrored in my daughter as well. She's not seeking out leadership roles, but she's getting them. They're putting them into her. They're encouraging her with that. I think that when you live your values, and if you think about leadership as influence, which I strongly do, then opportunities arise, or else you find that they create opportunities for you to exert that influence on a broader platform to make things better in the way that you think is personally meaningful to you. In terms of specific roles, it started kind of in national organizations. I was an inaugural member of the Women in Neuropsychology organization. And we're 20 some years out. I later served as the chair of that committee. And it's profoundly influential in terms of bringing women together in my field. There have been roles at the Cleveland Clinic in terms of helping reinvigorate the Women's Professional Staff Association, and we've seen it expand. We presented a business plan. We were able to hire a project manager, and it's been phenomenal to see the success of that. And I think by dint of those kinds of roles, that's how why I'm in the role I'm in now.
Okay. How would you describe your leadership style and how it works for you?
I think that there's no one leadership style. I think the most effective leaders look at the context and the needs and shift nimbly and flexibly between different leadership styles to accomplish the goals. That said, I tend to be collaborative. I tend to be open and curious with the goal of trying to understand other people's perspectives. I try and gather data, but then I want to be decisive and we act and we move forward. I think you need to kind of shift things in a way so that people do recognize that. I work hard at sharing with people how much I genuinely appreciate the work they do, right? I try and create a safe environment. I try to have a clear direction in which we're going and then hold people accountable. And I think it's an awful lot like parenting, right? Our goal is to launch people, and sometimes our kids need boundaries and rules. They need to know that it's a safe place, but they also have to be held accountable. And I think that's what most teams respond to. If you know where you're going, you feel like it's a safe environment where you can try on different things and be innovative, and that you're accountable, then that makes you feel like you're achieving what you're meant to do. So that's what I try and do.
Sounds great. Tell us, what do you see as the future of healthcare?
Oh, this has been worrying me for a long time. Even before COVID, we know that there were problems, and the models in healthcare are not sustainable, the financial models. COVID has really ripped open a lot of the problems within healthcare. In particular, we're looking at healthcare disparities, and they're highlighted front and center. And that's just immoral in my mind in terms of where we are with such a rich country, right? Secondly, we know that women in academic medicine disproportionately bore the burden of COVID, and it resulted in this huge backslide in terms of the progress that we had made. And I think it's going to take a long time for us to recover from that. I think that we need to start looking at different models of healthcare and healthcare reimbursement. And I think we need to start moving forward in terms of supporting everybody in healthcare, both our communities, all of our diverse communities, and our communities within the healthcare system, particularly those who have been hit very hard. I'm very concerned about recruitment and retention, right?
Mhm.
I think also that everything that's going on politically in our nation is creating further divisions and is going to impact our ability to recruit and retain top talent across the board. So I think we need to be really smart and build communities where people feel safe, and we have to take care of all of our communities.
Right, right. Okay, let's switch to research. The process of translational involves turning observations in the library, clinic, and in community into interventions that improve the health of individuals and the public, from diagnostic and therapeutics to medical procedures and behavior changes. In what ways does your work help support its researchers through the process of translation?
Yeah, no, I like this question because my research is highly interdisciplinary, which was kind of, comes from the fact that I want to be a learner and don't want to be pigeonholed into one little tiny box.
Mhm.
Highly interdisciplinary. And our research really focuses first and foremost on patients. And we hear a lot about patient-centered care and, PCORI and the whole bit. But the thing is that people don't really talk to their patients and see what matters most to them. And that's what my research does. And we use mixed methods to do that. And we do it in the context of patients who have serious brain diseases, like Parkinson's disease, depression, obsessive compulsive disorder, dementia, to try and figure out what matters most to them and why are they seeking out the innovative treatments they're seeking out. And are we measuring what matters most to them in terms of looking at outcomes? Why is this important? Because if patients' ideas of outcomes and expectations are like this, and the physicians are like this, they're not communicating. And that can lead to problems with informed consent. That can lead to situations in which the physician or the medical team is happy with the outcome and the patient is not. And that's not providing what I think is truly patient-centered care. Our research has shown that patients pursue deep brain stimulation for reasons that are not captured in standard outcome measures. Our research has shown that lay perceptions of personality differ very much from standard measures of personality. And we're also trying to figure out how can we use these data then to reduce some of the stigma associated with a neurological or neuropsychiatric illness or diagnosis, and or with those patients who have brain implants where we've got these ugly narratives like, you're Frankenstein or something of the sort, when we know that it can profoundly improve quality of life. So we're trying to refute some of the stigmatizing narratives out there in the literature, both academic as well as the popular literature regarding some of these diagnoses by using patients' voices and their experiences to illustrate a counter narrative. And then to do that in an empirical way to help improve outcome measures that really are truly patient-centered. So that's a very big, broad picture, but I think that it's critically important. And our goal is really not to just publish to publish, but to publish to make a difference in patients and clinicians' lives now in terms of how we provide care.
Right. Okay, with patient involvement being such a critical feature of all stages of translation, what opportunities do you see to help increase patient involvement or community outreach and engagement and all stages of research for those most underserved in our community?
I agree with this is critically important. In fact, this is one of the most important things that we are focusing on. I'm, saying it publicly now. I've said it a couple of times, but I'm going to get out 2 grants this year, which is kind of hard with juggling all my roles, right?
Mm-hmm.
But the critical piece is that we need to have different understandings from different groups about what they value. And we tend to think that health is something that we all understand and what healthy means, and that we all value the same things. that we all want to be super thin and super fit and like super, super smart and super, super happy and things like that. And I can tell you that not all patients think that way. Not all patients think that it's most important that they're super smart. Not all patients are terrified of a diagnosis of dementia, right? And there are different ways of viewing health, and they may be specific to different cultures, or there may be these common underlying themes that once again are divorced from how we typically practice medicine. And those understandings of health and disease impact the way that the questions we ask, how we think about health, how we measure outcomes, and the research we do. And the only way to get those diverse ideas and different ways of knowing and doing is to really ask patients and different community groups, what does this mean? To do that, I think means a lot of, relationship equity and trust equity, right? You have to develop trusting relationships with people who can inform you and teach me how to do this, teach me what's most important to them. To do that, they have to be able to trust me and so on. And that requires time and patience and humility and curiosity. So building those relationships, listening and kind of letting go of my expectations and being very open, I think is critical. How do you do that? I think you rely on the experts in the area, right? And that's once again, the fact that I rely on the people who do know how to do this and who can help guide me, hopefully toward a shared goal of making things better for all of our community, if that makes sense.
It makes sense, yes. Okay, switching to DEI. How do you live out principles and values of diversity, equity, and inclusion in your professional and personal life?
Well, I think it comes down to kind of, you're hearing some of my shared goals and values, right? And I think it's a willingness and a curiosity and a humility to hear other people's perspectives and to listen and to realize I don't know everything, right? In fact, I know very little things. All you have to do is ask my adult children, okay? And they will confirm that resoundingly. I think that, and this stems partly kind of from my studies in terms of religion and other humanities, but also, and this will sound kind of geeky, but I think it's really true, is that William James was the kind of founder of the American psychology, right? In addition, he's known along with Peirce and Dewey as the group of people who kind of founded the first American philosophical tradition of pragmatism. And philosophy, people think, oh my God, she's not going to go there, is she? Well, it's pretty simple. What they said, particularly in the context of ethics, is that you can solve ethical questions or challenges using empirical methods. Okay, I buy that. But they also said that what's most important really is diverse perspectives and different ways of knowing, thinking, doing, and being. And when you do that, that requires then some humility, right? Because I can't know what you do or think or feel or behave. So I have to ask that and listen with an open mind, right? And recognizing that there are all these different realities and experiences, I think helps open up the world in a way in which you're not just working on your autopilot and trying to figure this out, right? So that's one of the things that I really try and do. I also try to be very much aware of the fact that our brains are hardwired to give us shortcuts, right? And those shortcuts or cognitive heuristics are often not very thoughtful or helpful. What they do is they kind of help us categorize events or people or so on, experiences, in terms of different kinds, if you will, stereotypes, and can contribute to implicit biases. And so trying to be really intentional in terms of what I'm thinking, to question myself, to surround myself with people who are not afraid to challenge me, and also to actually directly seek out feedback and say, look, did I handle this situation right? Was I a little bit off in terms of how I asked this question? Did I barge in a little bit too quickly? How can I better support you? How can I elevate you? How can I leverage whatever positions I have to help you? So I think it's a couple of things, keeping in mind that there are diverse ways of knowing, doing, and being, and having the humility and the curiosity to recognize that. Two is really kind of recognizing that because of how our brains are hardwired, I have to work extra hard at being intentional and recognizing and reflective on when I may be falling into those traps or are taking those shortcuts that are not helpful. Surrounding myself with good people who are unafraid of calling me out if I do something inappropriate. And I always thank them because I think it's a gift. Feedback's a gift. And then directly asking for feedback in terms of how could I have done this better? What could I have done? How can I make this better next time I'm in this situation?
Fantastic. Yes. How can healthcare better support the development and continued ascension of women in leadership roles?
Well, as I said, and this is really something that I've been engaged in throughout my career and starting back to when I was young in terms of thinking about these issues. One, this is not a woman's problem, nor is it a minority problem. This is a culture problem. So stop trying to give us all these extra tools and strategies so we can improve. Not saying that that's not important. I mean, we've got whole faculty curricula devoted to some of those issues, right? This is a culture problem, and we need to stop thinking that it's women who need to be, if you will, remediated. It's a culture that does. And you have to have and build a culture that's based on shared norms and values, right? And that includes simple things like my mother taught me, kindness. That includes respect, integrity, and commitment to inclusive excellence, and acting on those values and holding people accountable to those values. And that has to come from both the top and the community, but it has to be something everybody embraces together. That's how everybody can thrive. I think that is critical. I think that there's a tremendous amount of work that we need to do, particularly since COVID. I think it's stretched everybody beyond belief, particularly women. And then, I think the intersectionality between gender and race ethnicity has also been particularly challenging during this time of COVID. So my goal is to figure out how do I, yes, provide some support, frank advice. Yes, this is what's going on. Create cohorts of women in leadership and those aspiring to leadership where they can say, hey, was this right? Did I read this right or wrong? Right? No, that's not in your head. You did interpret that exactly the way it should have been. I think also, I think it's really, really important for women in leadership, once again, thinking leadership is influence, and that means often more mid to more senior women, expend some of their social capital to make things better, right? And to support each other and to support the junior women. Sometimes people will say, well, we'll make it better for the junior women. The junior women should do this. Well, the junior women faculty have the most to lose. And I think it's people like me and other leaders, I see her on the screen here, where it's actually our moral obligation to expend some of our social capital to challenge those status quos, to help the broader community of women and those who are underrepresented, because women are still underrepresented in medicine, particularly in leadership. The numbers have not changed when you're looking at deanship, right? And no matter how many programs we put out there to try and improve that, it hasn't changed. It's not a pipeline issue, it's a culture issue. And so we have to start thinking outside the box. What are we going to do to affect culture change, improve the culture so it is truly more inclusive and excellent and allows everybody to thrive?
Right. Yes, I totally agree. Switching to healthcare and balance for you. How do you balance your professional aspirations and activities with self-care and wellness?
Well, I want to be very frank here, okay? Because I can see some younger people on the screen here, at least younger pictures here. It's easier for me now that my kids are launched. When I was a single mom with preteens and teenagers, you have to prioritize and you have to be comfortable with that. I think another thing that I think is important, if I can just put this plug in, because I think it's something that I try and say often, but I don't think I can say it often enough. We think in academic medicine that your career trajectory is just a straight line, ascending, 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 ascending. And we think that that's how it's supposed to be. And or that it's a really steep rise and then you kind of plateau. the data show that the most creative people, regardless of whatever career path they go, their career trajectory goes up and down. It is rising, but you're going to have dips. All right. COVID's a dip. You can look at mine and see, kind of moving along. Oh, babies, up grade school, up divorce, right? Up, and then things. And so I think that's really important to do. So just to recognize that there are different stages of a career in terms of kind of, if you will, this balance. I think you have to be intentional about it. What do I do? What I do, particularly as somebody who's single, right, is I invest a lot in my friendships and relationships. And so I'll organize things. I'll organize, if you will, play dates. And we'll go hiking as a group, or we'll go to the mixed parties at the art museum, or I'll see if we can go. I organize, monthly block parties, or, monthly potlucks, where we bring people together to create that social cohesion, right? And then I also realized that even though I like all those social activities, I'm very much an introvert. So I have to build time into my schedule for reading, writing, thinking, going on hikes by myself, going to the orchestra by myself, going to the art museum, whatever, because I need to balance that social and the me time to take care of myself. And if I don't invest in that, I get tired and cranky, and then I'm not intentional, I'm not productive. And I really need to do those kinds of things. As you know, I've got a vacation coming up, and I'm looking forward to reading and writing and hiking.
Great.
So kind of a geek, but that's okay.
Hey, that's how you balance.
Yeah.
That's your self-care.
Yeah.
What other women leaders can you do? I'm sorry, what are other women leaders can do to leverage their strengths to? What can other leaders do to leverage their strengths to affect impact as they ascend to leadership or execute in a leadership role?
Well, I think I mentioned some of this is supporting other women, right? In terms of saying, no, you didn't misread that. Very pragmatic things. How many times has somebody been the victim of mansplaining? I don't know if any of you are brave enough to raise your hands, but it's happened to me more times than I can count, right? And so if that happens in a group setting, say, I'm really glad that you brought that point up. That's exactly the excellent point that Jaleese just mentioned as well. And I'd like to elaborate on that a bit further. It sounds like you're supportive of Jaleese's idea. Is that right?
Yes.
And
Absolutely.
so sometimes you can do that, particularly if you're a little bit more senior. You can do that to amplify other voices. As I said, also, I think that having those more senior women exert some of their social capital to make things better is critical, because we've got more, if you will, credit in that bank that we can withdraw to make things better. I think supporting existing leadership who see these issues and really want to make things better. I think Dean Gerson clearly understands this, but he knows he doesn't know all of it because he's got his own perspective, right, in terms of his lived experiences. But supporting that, sharing ideas with them, and also creating allies with existing leaders, regardless of gender, race, ethnicity, and so on, and aligning on a shared goal, right, in which everybody can be the best they can be, right? So I think those are just some initial ideas.
Right. Great ideas. What would you like your legacy to look like?
In my vice dean role, what I would like my legacy to look like is that I helped shape a culture that is more kind, respectful, and truly embraces inclusive excellence, and built a team with a strong foundation based on those shared values and processes that will be sustained long after I'm out of my role. I want to build something that will change things, that will be sustainable. In general, kind of more broadly speaking, in terms of and this is my mission statement, is I want my legacy to be is that I make connections that help people flourish. I help connect people or ideas with the ultimate goal of helping people flourish, particularly those who may have been marginalized. And that's what I really want to do.
Fantastic. Okay, as a final takeaway, Dr. Kubu, what are 2 to 3 final takeaways you'd like to share with the audience?
I think that we're social relational beings, right? This is what our data clearly show. We value relationships. And so I think it's important to invest in those relationships, to have your team, both internally and externally, and to invest in those relationships and the people that will give you straight feedback, that love you no matter how many times you screw up. I think that that's critical. I think it's really important because we all work so hard that we know exactly why we're working so hard and for what reason, and that it's something that sustains us, something that's bigger than who we are, right? How and what small way do you want to make the world a better place? And if it's something that you truly believe in, it empowers you to do things you never, ever would have thought you could have done. And then probably the most important thing, and our data show this too, is play. Take time to play and have fun. Life is meant to be enjoyed. It's not supposed to be constantly working. I think it's really important that we take time to play like kids do, like we used to do, and not be afraid of being perfect or not being perfect, right? I had double negative in there, but just to play and just be and enjoy things. And I think that that is something too that can be very energizing. And life is to be enjoyed.
Wow. Thank you, Dr. Kubu.
Not a problem.
Such a great conversation.
Well, I don't know if it was a conversation, it was a monologue. But I hope we can get my picture out there and we can go to a conversation now.
Absolutely. Absolutely.
We can open it up for conversation right now.
If we could really change the view, please. So it's
Yeah, sure, absolutely.
Thank you.
How about that? Q&A.
So Cynthia, can I ask you a question?
Of course, Grace, you can always ask me a question.
Thank you. I enjoyed actually listening to you. I had to change a meeting last minute, but it was worth it. So, one thing, women versus men in terms of style of leadership, right?
Yeah.
If a man is, command, control, all the stuff that women sometimes, if they do, they're told.
Yeah. You're bossy, or I wrote a paper.
Yeah, exactly. Or
who does she think she is?
Yeah, exactly.
Women leadership in the B word, right? Yeah.
Exactly. Versus men, oh, they're great. They're tough. How do we change that? Because and even at our level, I mean, it just seemed like it's exhausting sometimes to make men who I have 2 boys, I have a husband who I love, so there are a lot of males in my life who I love very much, but at the same time I feel there's this disconnect. Women lead differently than men, in a good way, I think, because we're more nurturing, but that's seen sometimes as we're not as strong of leaders because we do that, and you try to go the other way around to be like the man, and it's not seen positively.
That's a great question, Grace. And there's a robust literature on this. And what it is there are gender role expectations. And when we think of men and women, well, women are kind and nurturing, they take care of other people, right? Whereas men are assertive, decisive, action-oriented, right? And then we think about, how do we typically think of the traditional leader? It's decisive, action-oriented, and the whole bit. And so women in leadership roles, and Eagly has written on this beautifully, have to navigate both gender role expectations and leadership role expectations. And it's a tightrope, because if you act too much like a leader, oh, you're not a woman, you're not warm and fuzzy. But if you act too much like in your gender role expectations, well, she's not a real leader, right? And so it creates this, Iberia has called it like a double bind. All right. So I think what we have to do is, there are a couple of things. One, I think those of us in leadership roles, and remember, leadership is influence, have to demonstrate you can be both at the same time. Pragmatically, too, it means that women sometimes have to work twice as hard as men, but with a smile and warmth all the time, which can be exhausting. But things haven't changed, and I don't want to BS anybody that, it's going to change. But I think having counterexamples helps. I think also that pragmatic things that I've tried to do now and then, and you may have witnessed it now and then, Grace, is sometimes I'll use humor to soften something, right? To make a point. I've done that at times when I didn't want to directly confront somebody. And I'll use humor to soften that. I do think being warm and curious is another way, but then to balance that with, at times you have to be directive, and this is what you think, and this is why you think it. I think another thing too, and I need to get much better at that, is sometimes saying less is more, right? And being very direct in communication. But it is a reality. It is a reality. There's a robust literature on this. Alice Eagley has written on this quite a bit. And it's how things are. And as I said, I don't think that COVID helped women in leadership at all.
Yeah.
I also think, just as an aside, is that there's this perception that, the women in leadership in medicine has already been solved, and it hasn't. Right.
Yeah.
But
Oh,
yeah, no, it's a
absolutely.
tough, and we can talk offline about this all the time we want, but I do think there are tricks to kind of navigate this. But I think one of the most important things we have to do, because we recognize this in ourselves, when we have these expectations or biases, we apply them until we get to know the real person. I'm like, oh no, this doesn't match my good friend Terry, right? And so I think giving counterexamples and being visible and encouraging other people to kind of challenge some of those things and to highlight those strengths is one way to break that down. But it can be challenging because they are pernicious. Good question.
And I hope the more women become leader, seeing this discrepancy between the styles and how people perceive it, hopefully it will get better, because as you have more women leader, I'm hoping that we can help each other to become more and more leaders.
I agree with you completely. And I think that there has to be that community. I think there's this kind of narrative out there about like Queen Bee and women shoot each other down and things like that. And I don't know if I can't remember, it was Sandberg. I can't remember who said there's a special place in hell for women who sabotage other women leaders. Right. Oh. And I really do. I don't think it was Sandberg. I can't remember who it was now. So maybe somebody else knows, but I think that that's accurate. And we support one another. Right. But it's still important that we maintain our goals and our priorities. And I think women leaders, I think, are held to a different standard. There's no doubt about that. And we have to produce. So I'm sorry if I brought everybody down on St. Patty's Day.
No, I think it's better to be realistic, actually, than to say, you know what, it's solved just because we have couple chairs who are women and couple vice deans. No, that doesn't solve the problem yet.
Not at all. Not at all.
Does anyone else have a question?
Oh, Madeline Albright. Thank you.
Yeah.
Thanks, Amy. Other questions? Push back on some of these ideas.
Oh, I have a question, Cynthia.
Sure.
Hopefully you can hear me okay. I'm at home on my earbuds because I'm trying to not make too much noise in the house. So you mentioned the non-linear career path, which I think is a really important concept. And yet, academic rewards in terms of promotion and tenure are modeled on a linear career path. So what can academic institutions do to better support the reality that most people don't have a linear career path and have multiple chapters to their professional life, and may have very productive chapters later in their career that will be cut off if they fall off of that, model of a linear career path?
Excellent question. And this is something that, while you partner with people in leadership, like, Grace and me and you and others, in terms of how do we start to reconceptualize a career path? because I've also looked at this literature as well. And we know that about every 7 or 10 years, your career kind of does a cycle and you do different things. I know looking at my career, it was epilepsy surgery first, then DBS, then ethics. And now we've got more of these leadership things, right? And so you kind of reinvent yourself across your career. And how do we start to use essentially data in terms of how people's careers actually work and make it, make the promotion process mirror the actual data rather than these false narratives that were largely set up to benefit, you know, I think people who were single and or had somebody at home taking care of everything so they could devote their entire lives to their careers, right? The other thing too that I'm working on gingerly, because you know I've only been in this role a couple of years, is to try and figure out how do we start to value other ways of contributing to academic medicine, particularly for underrepresented minorities, and women, where we try and lessen the burden of those the women's and minority tax. Okay, how do we value other ways of serving, whether it be mentoring or sponsoring, that are not traditionally valued as highly? So I think what you have to do, that's where you have to partner with people in that kind of leadership, those leadership roles, to have champions who can advocate for this using best practices and data. I think data are very good, and to see how can you leverage in terms of shifting cultures that way, in terms of what we reward and how we reward it and the timeline on which we do it. So those are some initial thoughts. I don't know if that helps or addresses the question that you raised, Amy.
No, yeah, I think that, sorry, I'm off camera because I'm trying to get my shoes on. I have to run out the door. I think that is very helpful. There's a lot of resistance, I think, to these institutional changes and changing, you know, the reward system that's been in place for so many decades. But yet, if we really value diversity, and if we want to have diversity in leadership and in our upper academic ranks, we have to find, you know, different ways of allowing people to succeed in their careers and to have those nonlinear careers and still have opportunities at our institution, because we don't want them to leave to do something else or to, you know, fall off of their professional sort of trajectory towards their career success. You know, I think it requires more individualization, more flexibility. And I'm glad that, you know, you're aware of this. I know that you're aware of this, and hopefully, you know, we can be a leader when it comes to academic medical centers in, you know, laying out alternative pathways that retain and reward our faculty for their successes.
Exactly. That's exactly it. And once again, there is a nice, robust literature, and, you know, these things have been published in very prominent journals as well. And so we can cite that and say, look, you know, creativity and these creative bursts across one's career occur at all stages of the career. And they should be celebrated. We have to recognize that there are going to be times where it's a little bit slower, but then it ramps up again. Exactly.
I think we may have time for one final question in the chat. I'll read it to you. Marginalization happens more often than not. How do we begin to break through these barriers to ensure true potential accelerates our performance within organizations?
Okay, so read that again. So I'm just trying to check it out. So marginalization happens throughout?
Yes, marginalization happens more often than not. How do we begin to break through these barriers to ensure true potential accelerates our performance within organizations?
Got it. I think that one, it's not a solo act, right? And this is a myth that is very damaging. And that, you know, the American myth of rugged individualism and we'll solve it all by ourselves. No, I think you have to have a community and support to do that. I think as part of that community, you have to have people who do have a platform to help make change and affect change. So you're looking at people in leadership positions. And I think too, that you think about what the culture or the institution values. And how do you align and create a win-win with what you want to do? I'm thinking very high level strategic. And so whoever posted, I'd love to enter into dialogue to make sure that I'm addressing it. I think you need to think, okay, what does this institution value? You know, when we started with the Cleveland Clinic, with the Women's Professional Staff Association, we went with a business plan and said, you don't want to lose any women. The cost of recruiting a new woman physician is 3 times or more the cost of keeping her there. We're here to help partner with you to make sure that women physicians stay at the clinic and that we're able to recruit top women physicians. So you figure out what is it that this institution values, how does that align with what you want to achieve? And then you work together to come up with solutions to make that happen by having a strong team, getting the data that you need and moving it forward. I think it has to be action. It has to be strategic alliance. And you have to demonstrate how this is a win-win for both the institution and the marginalized group. Does that kind of address the question? And as I said, pushback, I'm always welcome to pushback because it helps me think of things I haven't.
I'm not seeing anything else in the chat.
Okay.
So I think that was great.
Okay.
Are there any other last minute questions? We have a few minutes. Feel free to come off mute.
I'm about the safest and easiest person you can be vulnerable with. I'm sitting here in my dining room. Okay, come on. Right. And the only way we do this is by sharing ideas and experiences together. And anybody has any back channel follow-up questions, please reach out to me. I'm more than willing to engage in dialogue that way. I guess maybe a couple questions. Did this resonate with some of you? Have you experienced, particularly Grace's question about like leadership and women in leadership and those role expectations? Have some of you experienced similar kinds of examples? Resonates very much. Thank you, Pamela. I appreciate that. There is a literature out there, and not to plug one of my papers, but it was one of the most fun papers I wrote. It's just Google Kubu and who does she think she is? Women leadership in the B word. And we review some of that literature. Or anything that Alice Eagley has written. Great. Thank you, Shanelli.
Well, thank you so much, Dr. Kubu. Each fireside chat with the leading ladies is available for replay on the CTSC's YouTube channel. And we hope that you will all visit our website to miss any talks that you watch any talks you may have missed, and including a pre-recorded chat with Jill Dietrich Mellon from the VA Medical Center. What can you do today? We have a ready consultation at spark.case.edu. That's research equity, accessibility, diversity, and inclusion. That's with Jaleese. You can sign up to attend future programming and join our listserv, and you can visit our website to review the various DEIA resources that we have available. And since we have a little bit of time, we'll give you a virtual commute time to engage in a meaningful activity that will help give you some time back to yourself. You can move, breathe, or engage your senses. Dr. King is the founder of this principle and was our engaged break moderator yesterday at our unmeeting. And it was wonderful. She gave us an exercise to warm your palms and then place them over your eyes and kind of just be in the moment. And it was a nice little 5-minute relaxation. So maybe you can try that today.
That's awesome.
Otherwise, thank you so much, Dr. Kubu, again. Such a pleasure. We'll tell Jaleese you said hello, and have a great afternoon.
Yeah, no, and I just want to put out there too, how grateful I am for everybody that showed up and for all the work that you all do day in, day out. The work is very important and your contributions are noticed. And I'm very, very grateful for all the work that everybody does. Really and truly. So thank you.
Thank
Thank you for the
you.
opportunity and for the questions.
Bye.
Thank you so much. Bye, everyone.
Bye-bye.